How can I tell if it's influenza or a prolonged cold? Imagine feeling under the weather and wondering if you have the flu or just a cold that's sticking around. Both are viral respiratory illnesses, but they differ quite a bit in how they hit your body and how long they last. Knowing these differences can help you decide when to see a doctor and how to manage your symptoms. Influenza, or the flu, usually hits suddenly and with a bang. You might wake up feeling fine and then suddenly develop a high fever that climbs above 100.4 degrees Fahrenheit. Along with the fever, expect chills, muscle aches especially in your back, arms and legs, a pounding headache, and a feeling of extreme fatigue that makes even simple tasks seem exhausting. You might also have a dry, persistent cough that doesn't go away easily. These symptoms make you feel very ill very quickly. In contrast, a cold tends to develop more gradually. You might notice a runny or stuffy nose, sneezing, a sore throat, and a mild cough that often produces mucus. Fever with a cold is usually low-grade or absent, and you might feel tired but still able to carry on with your daily routine. Cold symptoms tend to be milder overall, and while they can last a week or more, they usually improve gradually. Duration is another key difference. Flu symptoms typically last about 5 to 7 days, but fatigue and weakness can linger for 1 or 2 weeks. Cold symptoms often last longer in terms of nasal congestion and cough, sometimes stretching beyond 10 days, but they generally stay milder. High fever and body aches are common with the flu but rare or mild with a cold. If you experience a sudden, intense onset of symptoms with high fever and muscle pain, it's more likely the flu. Conversely, if your symptoms started slowly, are milder, and include a lot of nasal mucus and sneezing, it's probably a prolonged cold. Cough type also helps distinguish them. The flu often causes a dry cough, while colds tend to produce a wet cough with mucus. If you feel extremely tired and weak, making it hard to do your normal activities, that points more toward influenza. A cold usually causes some tiredness but not the severe exhaustion you get with the flu. If your symptoms last more than 10 days or worsen, especially with a cough, congestion, or sinus pain, it could be a secondary bacterial infection or another issue, and you should see a healthcare professional. Influenza can sometimes lead to serious complications like pneumonia, especially in vulnerable groups such as the elderly, young children, or those with certain health conditions. In summary, if your symptoms came on suddenly with high fever, severe muscle aches, and intense fatigue, it's more likely influenza. If they developed gradually, are milder, and include a runny nose and sneezing, it's probably a prolonged cold. Remember, individual experiences vary, and if you're unsure or your symptoms worsen, it's always best to consult a healthcare provider for an accurate diagnosis and appropriate care. This distinction is important because influenza can cause more serious health issues and may requiring specific treatments or preventive measures like vaccination. Always seek personalized medical advice to ensure you get the right care for your situation.